Ear infections are very common in the pediatric population. The term ear infection is actually a terminology for the infection or inflammation of the space behind the eardrum, and we term it acute otitis media. From the ages of 6 months to 3 years, about 50 to 85% of children can have one or more episode of acute otitis media. So one of the most common reasons children present to the pediatrician outside of wellness checks. The symptoms of an ear infection include fever, ear pain, fussiness, poor sleep, and overall just a feeling of lethargy and feeling sick. The reason that ear infections affect toddlers more often than older children is related to immunity as well as maturity of our ears. So the ability to pop our ears and clear the fluid gets better with age. So when you hear about kids growing out of ear infections, what's really happening is their body and their ability to clear the fluid from behind the eardrum by popping their ears, as well as their immune system has matured. The treatment options for ear infections include high-dose antibiotics such as amoxicillin, watchful waiting, especially if your child does not have severe infections. You can talk about that with your pediatrician. And if your child has had a lot of ear infections, that's when it's time for a referral to pediatric ENT to discuss the option of ear tubes. Ear tubes are a small device that we place in the eardrum. It kind of looks like a sewing bobbin with a hole in the center, and it keeps the space behind the eardrum clean and dry. And we do that for kids who've had a lot of ear infections or concerns for fluid in their ears and hearing loss. Ear tubes are the most common procedure that pediatric ENTs do. If you look at data across the country, about 15% of children who are in daycare do end up with ear tubes because of ear infections. Although ear tubes are done under general anesthesia, it's a very short and overall very easy general anesthetic. Your child goes to sleep with a mask, is asleep for about 5 minutes, and goes home the same day. The procedure is not associated with any pain, and the recovery is pretty easy. Ear tubes, on average, last for about a year and fall out on their own, so no need for a second procedure. And the goal for placement of ear tubes is to get your child through this period in life where they're prone to ear infections and then hopefully don't need them anymore. Ways to prevent ear infections include general hand hygiene, simple things that we recommend when any kid is sick: to not share utensils, wash your hands, and just try to stay safe and healthy. If you have concerns that your child is being diagnosed with a lot of ear infections, your best source is to see your pediatrician, as they know your child best and can refer you to the appropriate provider if needed.